Well, good morning and welcome to today's webinar. My name is Adrian Walker. I am the Director of Government Affairs and Community Relations for the Flint and Genesee Chamber of Commerce. I wanted to first thank everyone for taking the time out of their schedules to join us today for this webinar. For today's webinar, joining us, we have Michigan Lieutenant Governor Garlin Gilchrist. We have State Senator and Minority Leader Jim Ananich, and we have Jeff Donafrio from the Michigan Department of Labor and Economic Opportunity. Listening in, we also have State Representative Cheryl Kennedy from Davison, and we also have State Representative John Cherry from the city of Flint. The purpose of today's webinar is to hear from our state leaders as it relates to the state's response to the coronavirus crisis, but to also get an update from them on what reopening our state might look like at that time that happens. After our discussion, we will bring everyone back up for a moderated Q&A from our live news feeds and the questions that you as viewers submit. With that being said, I wanted to start today's conversations with the Lieutenant Governor. And again, thank you, Lieutenant Governor, for being with us today.
Thank you, Adrian.
Thank you, Adrian. No problem. Wanted to thank you. And Lieutenant Governor, I wanted to make sure for your remarks that yesterday the governor mentioned that today actually marks the 6th anniversary since the state of Michigan announced their first coronavirus case. Since that point, the state of Michigan has taken some extraordinary measures to protect the health of our residents, our economy, but also aimed at flattening the coronavirus curve. We'd love for you to talk about that, but Lieutenant Governor, we also understand that this virus has impacted everyone across the state of Michigan, especially the African American community. Yesterday, you talked about how in the state of Michigan, African Americans account for 15% of the state's population. However, we are currently at 40% of the state's deaths. Here in Genesee County, that number for African Americans is about 42% of confirmed COVID cases and about 51% of the county's confirmed deaths. Understanding that, you all announced the Michigan Task Force on Racial Disparities yesterday that you're going to be the chair of. We'd love for you to talk about how that task force will address the racial disparities in minorities communities. Without further ado, I'll turn it over to you, Lieutenant Governor.
Sure. Thank you, Adrian. And I want to thank my panelists here, Adrian, Senator Ananich, Director Donafrio, and I also want to thank the legislators on the call and everyone for participating in this conversation. Adrian's right. 6 weeks ago today, we announced that we were made aware of the first 2 confirmed positive test results for infections with the coronavirus. And it certainly feels like that was a long time ago, given the amount of action that we have taken as a state to try to respond to this pandemic and how it has landed here in the state of Michigan. I believe that, Governor Gretchen Whitmer and I, our primary responsibility is protecting and promoting public health and public safety. And that certainly has been at the front of our minds as we have made the choices and taken the actions that we felt necessary in order to protect the people of Michigan and set us up to be able to handle this pandemic in the best way possible to get to the other side of it. So I want to speak a little bit about some of the action that we've taken and why we deem it's important. So the most consequential one has certainly been our Stay Home, Stay Safe executive order that we issued another iteration of last week. The goal of this is to, as Adrian said, to flatten the curve. What that means is we want to, slow the spread of the virus. We understand that coronavirus spreads very easily through person-to-person contact, particularly when they're in close proximity and especially when they're indoors. So the Stay Home, Stay Safe order is just asking people to, if they are able, to stay at home, to limit their non-emergency or non-essential trips outside of their home. Yes, there are certain things that you still can do which are necessary to protect and sustain life. You can still get food. You can still go to the pharmacy and get prescription drugs. You can still get gas for your car. There are a lot of workers who are working in job functions that are critical to sustaining life. Obviously, our healthcare professionals, our first responders, people who are working at grocery stores, people who are driving public transit systems, who are sanitation workers, those who are actually working in utility companies to keep the power and the lights and the gas on, the internet running, so we can do conference calls like this. Those people are certainly going to work, and we thank them for their service during this time to our entire state. But everyone else who's able to, we're asking you to stay home. And that has led to a few things, and it has paused economic activity in a way that I'll talk about in a moment. But we are beginning to see that it has had an impact on slowing the spread of the infection. That is really important because we need to make sure that our healthcare systems and our healthcare providers in different parts of the state were not overrun. Early on, we saw systems in Detroit that were at or near capacity. And thanks to people minding these orders, we have begun to see that trend decrease considerably, and we're looking to flatten the curve. So that's good. Now, the question becomes, though, how do we emerge on the other side of this? From just a normalcy of life perspective, as well as an economic perspective. And this is something that is important to us to think about. That said, I want to be really clear that the primary drivers in the decision about how we re-engage sectors of our economy is driven by people. It's driven by the science and understanding led by public health professionals to help us know what things are looking like and how the virus is spreading and the impact of the infection. But our economy doesn't work if our people are not healthy and they don't feel healthy. If they don't feel confident in leaving their homes to go patronize businesses or go to restaurants and bars or go to events. So that confidence is what we are building on and building toward, and what we'll be thinking about as we think about how to establish a new normal for our economy going forward. I know Director Donafrio is going to speak to perhaps some of that a little bit, but also some of the actions that we've taken in the meantime with this unprecedented economic pause, this unprecedented activity pause. We've worked to expand the safety net, whether that's access to healthcare, access to unemployment insurance, ensuring that people are protected during this time. People are protected from evictions. People are protected from utility shutoffs. There have been loan payments have been suspended for student loans and all these sorts of things from the federal and the state government. We want people to be able to get through this, all while staying safe, all while limiting their activity and their exposure for their family members, their loved ones, and their communities. Now, Adrian asked me to speak a little bit about the task force on racial disparities. The numbers that he referred to and that we've been looking at the state level, the only reason we even know that is because Michigan was one of the first and remains one of the few states that actually reports out COVID-19 test results and deaths on racial and ethnic lines. So that made this glaring disparity quite visible. And the fact that this virus and this infection kills so quickly really upped the urgency of our work on racial disparities when it comes to health outcomes. Our administration had already been taking action, whether that was through the things identified in the Thriving Cities Tour, where I went to 19 cities across the state to talk about quality of life issues in cities, and we including having a stop in Flint, but also our poverty task force we established in December, which is recognizing the fact that there are many social determinants of health, including fighting persistent poverty, that have led to poor health outcomes in communities across our state. And then finally, the Healthy Moms, Healthy Babies initiative that was announced in the State of the State in February specifically addresses the health disparities when it comes to maternal mortality rates when comparing Black women to white women, because Black women are 3 times more likely to die of pregnancy-related causes than white women. So this is building on that framework and that momentum, but doing so with an increased urgency because this virus kills quickly. So we are looking to take interventions that are going to address the increased risk of exposure for communities of color and Black folks in particular, who tend to work in those jobs that are on the front lines and still working. They have a much higher risk of exposure. Or you have a high risk of exposure if you can't afford to buy hundreds of dollars worth of groceries and then not go to the store for a month. And especially if you have to take public transit to get to the store. So we're looking to put on the ground interventions to help people who are impacted in that way. We also have been releasing through our Chief Medical Executive, Dr. Jonae Caldoon, guidance to healthcare providers about implicit bias and bias in medical testing and treatment, which has been shown to lead to poor health outcomes, as well as looking at more strict guidance about sharing demographic data on results so we can have an even more complete picture of who is infected and how we're treating them. We also are looking to make sure that we can increase testing accessibility and availability that has increased in the Flint and Genesee County area, and we're working to expand it to more communities across the state. Also in making available not just drive-up testing, but also walk-up testing for particularly vulnerable communities, and trying to make sure that just anyone who needs a test, anyone who wants a test can get a test, and also that we can increase our testing capacity to test people who do not have symptoms. That's really important because in order for us to think about re-engaging the economy, we have to set up our infrastructure to tackle three big issues. The first is ensuring that we have adequate testing, which is including testing people who are not currently showing symptoms. We've dramatically increased our testing guidance and protocols to enable this to begin to happen in parts of the state, focusing on our critical infrastructure workers. And we need to go farther because that will be the only way that we can truly understand how the virus is spreading in our community. The second component is tracing. You may have heard this phrase contact tracing before, but what tracing means is essentially when a person has tested positive for COVID-19, we then need to be able to work with them to understand who they have come in contact with and possibly expose the virus to so that those people can be tested as well. That tracing element, again, helps us understand how the virus has or may be spreading in a community. And it then leads, understanding the tracing leads to the third component, which is containment and isolation. How can we ensure that people who have been exposed or who have tested positive have the ability to isolate themselves safely so that they are no longer spreading the virus within the community? There's also an equity challenge when it comes to isolation because people who are living in persistent poverty or in small homes or in, one-bedroom apartments, it is impossible for them to completely isolate from those whom they live with. So we're also working to build up infrastructure to support that where people can safely isolate. And that's for individuals as well as for our first responders, building off of a model like the one that launched in Dearborn, Michigan today for first responders to be able to drive up, get a 15-minute test, and then isolate in place if necessary to not expose their family members. We're working hard every single day. The professionals in state government, particularly our Department of Health and Human Services, but across government at the state level, at the local level, and yes, even our partners at the federal level are doing everything that we can to make sure that we can save as many lives as possible, expose as few people as possible, and get through this pandemic in Michigan as responsibly as we possibly can. That requires a level of collaboration that we've seen on the state level in a way that we haven't seen really in our lifetimes. And that's because this is something that none of us have ever lived through, none of us have ever led through, but we all can get through by working together. Lastly, I'll just say that I think the important principle that really sort of inspires me during this time is the fact that we have taken the steps to do this social distancing practices, that we have taken the steps to encourage staying home and connecting with people through other means. The social distancing irony is that it actually reveals how connected that we are to one another, how connected our relationships are, not just our family members and loved ones, but also with the businesses that make our community what they are and that give our community such identity. And we need to work to ensure that as we go forward, we're even stronger supporters of one another and of those businesses because they are really not just the lifeblood of our communities, but really they're the fabric of our identity. And I think we're going to value that differently going forward because we have gone through this pandemic together. And I'm inspired by getting to that future with all of you. So thank you for what you're doing. And I'm looking forward to answering any questions.
Thank you, Lieutenant Governor Gilchrist. And now I want to bring up State Senator and Minority Leader Jim Ananich. Senator Ananich, thank you again for taking the time out of your schedule to join us today. Yesterday during her press conference, the governor mentioned how the next 10, now 9 days will be crucial to how life looks after the current shelter in place expires on April 30th, whether that's another extension or loosening some restrictions. Would love for you to talk about what a return or a restart to our economy would look like. But Senator, I would also be remiss if I didn't mention a call I was on last week with some festival and event planners here in the city of Flint. As you know, with the weather turning, I know it doesn't look like that right now outside with the snow. This is really the time that our city comes back to life with different festivals and events, whether it's the Creme, Back to the Bricks, going to see a show at the Capitol, or just going out to eat at a local restaurant in our community, and just the economic impact that has on our local communities. So the main question is also wanting them to understand what that new normal could look like after once restrictions are loosened and we return to this or get back to the new normal.
Yeah, thank you, Adrian. And obviously, thank you, Lieutenant Governor and Director Donafrio, for being on with me today as well. Yeah, I think we all have to come to sort of a realization that the future is going to be different than we've seen in the past. This is something we've never addressed before. The COVID-19 is and this virus is changing the way we do things. And I think we can either wallow on that and be stressful and try to fight it, or we can try to be productive in a way that makes sure that the new workplace, the new way we do life is just as vibrant and as productive as it was before. One thing before I get into that, I think it's important to note that here in our community, I've seen just across the state, but stressing it here in particular, I've seen amazing amounts of generosity and people caring for each other, whether it's businesses donating food. We've seen that all across the spectrum, right next door to the chamber and Blackstone's closing off for regular business and just donating food every day. Hoffman's, Italian Gardens, Luigi's, and the list goes on and on and on. The White Horse, just amazing people doing amazing things, because that's what we need to do when we're in situations like this. I know a number of businesses have reached out to me, and I've connected them with the state when it comes to trying to move some of their operations to help with some of the shortages, whether it's PPE or some other things of that nature. I think that's amazing. We have so many members and businesses in our community that are just doing tremendous work. Our hospitals are partnering like we've never seen before. We have the drive-up testing at Atwood Stadium and so many other things that are amazing that I think it's just important to note, because obviously when we're stuck in a stressful situation, we have to remember the real positive things that are going on and realize that the future is hopeful. Obviously we're going through a tough time now, and the leadership of the governor and lieutenant governor to put in place a stay-home order as early as they did, without question. This is not something you really can debate. We have slowed the curve, right? Now, the length of which we've slowed the curve and how long we've been able to do that, that's still up for analysis. But there's no question. President Trump recognized the city of Detroit, the mayor, and obviously the governor with that, that being the one of the major cities having the most slowing of the growth. And we're seeing tremendous work being done all across the spectrum. So as stressful, as tough as the stay-at-home order is, it's having the desired effect. And I think that's important to note. So to your point, Adrian, I live here and lived here my whole life. I've spent time, I will say, watching the Crim. I'm not necessarily a participant, but I think it's a great event. There's so many other amazing events. As we go forward, we're going to have to figure out as a community, as a state, how we can phase in our operations. There'll be certain things that we'll be able to do much easier. I think, obviously, auto dealerships, for example, they're doing online sales now. There'll be a point in time in the near future where they can open up their showrooms in a safe, industry standard, safe and professional way. Some of the other things will be tougher to do. I don't think we'll be going to a concert at Little Caesars Arena anytime soon, because it's very difficult to socially distance. It's very difficult to take health precautions. But I think if I was a business owner, I would be talking to my trade association, whether it's a chamber or national organizations, about what are the best practices nationwide, internationally, for cleaning and sterilization processes, for how to protect your workers and the customers that are coming in, and then expect and listen for guidance coming out of the state, because it's going to be incumbent on us as individuals, as business owners in this capacity, and customers, to make sure that we take every step we can to protect ourselves and protect others. As was mentioned, there's a number of, I don't know the exact percentages, but we know we've had over 30,000 people that we know test positive. There are a number of other people that, by and large, probably have COVID and they're asymptomatic, meaning they're not showing any symptoms, and they could potentially be passing that on to other people. So as we continue to ramp up testing, we're going to find that there are more people that have this disease than we knew of. Now, obviously, if you get COVID, does not mean that you're going to get to the ultimate, that you're going to pass away, and hopefully that doesn't happen, and we can continue to work on saving as many people as possible. But that does not mean that you can't pass it on to a loved one or someone else. And there are a number of people in our community and across the state that have underlying health conditions, they're elderly, that are much more susceptible to the dangers of COVID. So we're all going to have to do our part. We're going to have to be vigilant for a long time. This is not something that we can just, start to wash our hands more and wear a mask for a few days. And then, as we do with a number of habits, we say, well, I don't need to wear it today. I don't need to be as careful. I think I'm okay. This is going to be something we're all going to have a responsibility in following the guidelines of the state and CDC to make sure that we're doing everything we can to make sure we keep ourselves healthy and our family healthy, but also the people we come in contact with. So I'll stop now and hand it over to Adrian, who can hand it over to Director Donafrio, because I think my best value will be in answering questions and helping to give guidance that way. But thank you very much for the opportunity.
Thank you again, Senator Ananich, for joining today's call. And now I want to bring up, as Senator Ananich mentioned, Jeff Donafrio, who's the Director of the Department of Labor and Economic Opportunities. Again, Jeff, I want to thank you for joining us for today's call. Jeff, also wanted to point out that I think right now your mic is on mute, so I wanted to make sure that you're unmuted. So, Jeff, when I talk to our members, one of the top questions that have come in since we've been dealing with this crisis deals with the issue of the unemployment insurance program. Yesterday, during our call with our federal elected officials, it was pointed out that Michigan, I believe, ranks the second highest state as it relates to unemployment insurance claims. I was reading an article yesterday in Bridge Magazine that mentioned between March 25th and April 4th, your department processed over 817,000 unemployment insurance claims, which I think is a huge kudos to the work that you're doing as a director and your staff as well. That same article pointed out, unfortunately, that 40,000 people still had difficulties with processing a claim. So would just hope in your presentation that you can speak to the work that you and your department is doing as it relates to the unprecedented demand for the state's unemployment insurance program. I'll turn it over to you, Jeff.
Sure, thanks. Can you hear me now? All right, well, I will assume you are hearing me now. But the presentation I'm going to give is to talk about, I think, two aspects: unemployment and then I think business support. So LEO, the Department of Labor and Economic Opportunity, really provides a number of different services to the people of Michigan. We encompass all the labor, housing, workforce, and economic development functions of state government. Unemployment Insurance Agency is one of 16 that's included within LEO. And of course, is really important right now. I think, as was mentioned, we have seen unprecedented volumes, and so let's talk about that. We're now up to more than 1 million people, about a quarter of the state's workforce, that have filed for unemployment since March 15th. Typically, the Unemployment Insurance Agency processes about 5,000 claims a week. We exceeded that, and we exceeded the highest record claim during the Great Recession in a week, which was 77,000 every single week during the pandemic. So you can see here the chart. The first week we had 130,000 claims. The second week, 310,000. The third, almost 390,000. And this last week, about 239,000. So we see it's easing a bit. That people are getting through. And again, we're over 1 million total claims for individuals who are coming in. Again, during the Great Recession, the highest total number of active claims that we had was about 388,000, and we surpassed that in 1 week. So unprecedented, historic claims, and something that, I think no unemployment agency across the country has been designed to really handle. Typically, it's much lower volumes, and we have a ramp up during a recession. So the benefits paid so far, about 780,000, and that number is a couple of days old, so that has grown. But 780,000 unemployed workers affected by COVID-19 who've applied for benefits have gotten them. And we're at $825 million in payments that have been paid out so far. I would expect in the next few days, we'll get actually up to about 1 million people having been paid benefits, and over $1 billion in payments having gone out through our administration. During the Great Recession, again, 363,000 was the high. This week alone, there'll probably be about 300,000 people who will be eligible to certify for their first payments. So again, we're seeing that number climb up significantly every week that goes on here. Michigan's one of the first states to pay out the extra $600 in benefits weekly under the CARES Act. We started doing that on April 8th, just 3 or 4 days after the Department of Labor gave us guidance on how to do that, how to rewrite our systems and orient our systems to be able to pay that out. And then last week, we became one of the only states in the Midwest and one of the first states in the country to begin accepting applications for independent contractors, self-employed, and 1099s. So, for instance, Ohio, you won't be able to apply until mid-May. Illinois, May 11th. Indiana, May 4th. So Michigan is definitely leading the pack there. And in terms of comparisons to where other states are in terms of paying out claims, if you look at the state of Florida, which was just reported today, they've paid out 40,000 benefits and received 1.5 million claims in their state. So I know that that's cold comfort to a lot of people who are waiting, and there are a lot out there who, of course, have had some sort of issue with their account. Either they've been locked out, and we're working to address that. They have a hold, a non-monetary hold on their account. And a non-monetary hold, just so you understand, is something that the federal government requires an individual to actually look at the account, talk to the individual potentially, and gather more information. That can be because a person was involuntarily separated, so they were fired potentially, and their employer is disputing their ability to get unemployment insurance. It could be because there's a flag on identity theft, and we know that across the country, a lot of people are potentially applying fraudulently and trying to steal individuals' identities if they have the appropriate information. So we are trying to be very careful and make sure that we're not paying out anyone inappropriately and hurting someone in the process who needs that benefit. And then there are issues where our data just, unfortunately, it lags. So there's tens of thousands of people who changed jobs in the last few months, and those folks, we have to verify by federal law who their new employer is and the fact that they have come into the system in an appropriate way. Again, we are incredibly, incredibly sympathetic to the frustration that individuals are having who are in these cases. And I can just tell you that, we're working around the clock. We're throwing every resource we can. We've more than quadrupled the staff helping work on these issues. And we've got, another 400 or 500 people on the way trying to help resolve these issues as well. And we're not going to rest until you get your benefits. And we promise everybody who is eligible for benefits and applies is going to get them. So we look at who's eligible right now. So for those who are sick, who have who are immunocompromised, who are quarantined, who are caring for a loved one unexpectedly, and they don't have paid sick time or paid leave, you're eligible for unemployment insurance now. Again, Michigan became one of the first states to welcome in independent contractors, gig economy workers, and self-employed, and also low-wage workers who hadn't otherwise qualified in the past. For any individual, and a lot of them, about 350,000 applied before the eligibility came down from the federal government. You don't have to reapply. Simply go into your MyWham account, look at, there's a couple of prompts that will show to give us and submit information for pandemic unemployment assistance. Again, go into your MyWham account if you haven't already, and most folks have, but there are a few that we're still trying to track down to give us that information on pandemic unemployment assistance so that we can give the federal government your information and begin paying you. Those payments for self-employed independent contractor and gig workers, again, we're one of the first states to begin paying out this week. So while Ohio, Indiana, Illinois haven't even opened up applications, we're starting to pay out this week. So who's not eligible? So individuals who are on paid sick leave or other paid leave and are receiving some sort of income from their employer still are not eligible. Individuals who have the ability to telework with the same amount of pay that they were getting, or who are offered jobs in an essential or critical infrastructure industry to work, they are still employed or considered to be ineligible then for unemployment insurance. And then again, individuals who potentially quit work only to get unemployment insurance, you would be ineligible as well under that scenario. So workers, again, will receive their benefits. There is not a penalty for when you file. Right now we're waiving all of those to make sure that every single person gets the benefits they deserve, regardless of when they file, if they've been displaced because of COVID-19. We have increased accessibility and tried to waive as many requirements that we can. The lieutenant governor and governor have made sure of that we've waived in-person work registration requirements and work search requirements. We know there's not a lot of jobs out there, so we're not asking you to look for work while you're on unemployment at this point. We've extended benefits from 20 weeks to 39 weeks. And again, because of the CARES Act, we've been able to increase the $362 of up to weekly wages that the state of Michigan pays. We've added another $600 on top of that. And that funding, again, started going out as early to people as April 8th. So the way to file, again, michigan.gov/UIA. Quickest, easiest way. It's open 24 hours a day. We encourage people to make sure to do that on an off-peak hour, so after 8 o'clock if possible. And then we're breaking people down by last name so as not to overload the system any one day. So to file or to certify that you're still unemployed and eligible for benefits, for those whose last name is A through L, we're asking you to go on Monday, Wednesday, and Friday. For those who are M through Z, we're asking you to go on Sunday, Tuesday, and Thursday. Saturday, anyone can go on, and if you didn't get to it that day, you can file or you can certify your claim. What you're going to need is a Social Security card, some sort of state-issued ID card, so a driver's license or an ID card. Name and address of your employers you worked for in the last 18 months and some information about those employers. And then if you're not a U.S. citizen, you're going to need your alien registration card and then your work authorization expiration date. Again, you'll have to certify every 2 weeks that you are still unemployed and that you are able to receive benefits, so that you haven't been offered your job back, either teleworking or as we start to reopen the economy. Again, you go to michigan.gov/UIA to do that certification. So let's talk quickly about resources for employers. So for those who are looking at potentially, they've either dropped the hours of the individuals working for them or they're contemplating layoffs, we've expanded the work share program through unemployment insurance. This is an agreement that you enter in with us. We subsidize the payroll for your workers. And then the nice thing is that between until July, the end of July, when the CARES Act $600 extra weekly runs out, we will be able to give the extra $600 a week to your workers, even if they've had a reduction of as little as 15% of their hours. So we very much encourage employers to go to michigan.gov/workshare, find out about the program, and register there. There are about 5,000 employees who are on the workshare program right now. We've also done things for small businesses, particularly at the Michigan Economic Development Corporation. All the things that I'm going to talk about here in the next few minutes, you can go to michiganbusiness.org/COVID-19. Again, michiganbusiness.org/COVID-19 and find out more information about all of these programs. You can also call 888-522-0103. So we've had a number of programs that we've created in the last few weeks. A tech startup stabilization fund, which is helping those tech startups be able to weather the COVID-19 pandemic, $3 million, run by ID Ventures in Detroit. A COVID-19 mobility solutions grant, which helps provide dollars for individual companies that are helping address mobility solutions during this crisis. That applications are open for another few days through April 24th. We've stood up a Pure Michigan Business Connect Emergency Access Retooling Grants program, and we've awarded 12 grants through that program to help individual companies retool and make that really the personal protective equipment, the health equipment that we need during this crisis. We've put in place the Michigan Small Business Relief Program, which provided $10 million in grants and $10 million in loans, low interest loans, to small businesses across the state. All 83 counties have been covered by this in terms of the local economic development organizations that serve those areas. A lot of those local EDOs actually matched funding locally. And so that $20 million became much, much more. We know it's not enough, and we know we're trying to figure out ways to help gain access to other federal programs that are going to come through in the next few weeks and months as well. We've also put $2 million into the Northern Initiatives program at MEDC for women and minority-owned businesses who are affected and impacted disproportionately here. We've been approved for small business administration loans. This was an application that we put in really the first week of the pandemic. And you can get up to $2 million in small interest loans through the SBA. And then the Paycheck Protection Program, which we know has run out of funding right now, but which is very close to being refunded or recapitalized by the federal government. we launched a website to help small businesses in particular be able to understand if they qualify for the Paycheck Protection Program, PPP, and if they would be able to apply and how to do that. The Lieutenant Governor helped launch that just a few weeks ago. That website is mipaycheckprotection.com. Again, mipaycheckprotection.com. So far, about 25,000 business loans have been approved for Michigan, which represents about $7.3 billion. We've also done things like help with tax assistance, so to provide liquidity to small businesses in this very critical time. So we've worked with the Department of Treasury to make sure that sales use withholding tax for March and April can be delayed until May. If folks have questions on that, they can go to call 517-636-6925. One thing that's not mentioned here is the liquor buyback program that we worked with Laura and the Liquor Control Commission on to help buy back alcohol that was sitting on shelves at many restaurants and bars who were, it's hard to believe that it was just before St. Patrick's Day and March Madness that this pandemic hit, but a lot of them had put in orders for a large amount of alcohol that they could not sell. And so we're providing those dollars back to them to be able to make sure that they can have liquidity during this period of time. So I'll pause there and happy to take questions or turn it over to the next person.
Thank you again, Jeff, for that very informative conversation and update as it relates to the work that you and your agency is doing. I now want to turn it over to my colleague, Stephen Elkins, for the moderated QA portion of this conversation. Stephen.
Yep. Thank you. Thanks, Adrian. Thanks, Director, Lieutenant Governor, and Senator Ananich. Quite frankly, most of the comments and conversation has been around unemployment, accessibility, capacity. Director, could you just, I'm trying to articulate questions from our viewers. Can you talk about capacity, your timeline to ramp up that capacity and turn around these applications?
Yep. So the vast majority of applications have already been turned around and approved for benefits. So we've had more than 1 million come in, and as of this week, we will be paying more than 1 million benefits or beneficiaries. So there are a small percentage of people, and in this case, when we talk about 1 million people, a small percent is still a large number of individuals who have some sort of issue that we need to resolve in one-on-one. And we're working to do that. We've quadrupled our staff, more than quadrupled our staff. Again, we have another, hundreds, I believe it's around 600 people in the pipeline that we're hiring, that we're contracting with through third-party providers. We're even going to organizations who have some familiarity with unemployment insurance and authorizing them to be able to come into our systems and help people resolve those claims. But for some very specific legal challenges that are out there, and this happens in every benefits program where a person may have not provided the right information, an employer may be challenging a person's eligibility, there may be identity theft or fraud issues that we have to resolve. We have to unfortunately go in one-on-one. And so it is going to take a little bit of time to get through those particular cases. We're throwing every member of the staff that we can at that. We're making sure to, again, hire new staff, and we're very, very sympathetic to the frustration people are feeling. And I tell you, it keeps me up at night. I know that's little comfort for folks, but we're trying to do everything we can. I can tell you the things that people generally are coming to us with as the most common problems. They have an account that's been locked, or they've filed multiple times under multiple different accounts, and so we have to dedupe that. There are tens of thousands of folks who fall into that category. We're hoping to get through the vast majority of them this week, right? To unlock those accounts, provide authorization or authentication codes, to do all of that work. I've got hundreds of people working on that just now. For those who have a non-monetary issue, those generally take a little bit more time. And so, I'm trying to be as honest and transparent as we can. We are not the only state every state is dealing with this at these high volumes. But again, we're trying to get through them as quickly as possible. So we ask for grace and patience in this moment.
Thank you. Thank you, Director. I see a few questions here. The first one, Director, this one is for you as well. Individuals who are in a sales profession, say primarily commission-based, what are their options? They're not laid off, they're not unemployed, they're still on the job, but the income is not where it typically is.
So if your income has fallen, and we have a ceiling that you can make in terms of income, which is just under $500, but if your income has fallen below that, you would be eligible potentially for underemployment benefits. And those underemployment benefits would give you a percent of the Michigan benefit, which is up to $362. And then up until the end of July, if you qualify for benefits, you would get the additional $600 of pandemic unemployment assistance that's being offered by the federal government. So still go on, still file at michigan.gov/UIA. If your income has fallen again below that just under $400 or just under $500 threshold.
Okay, thank you. Another question for you, Director. I'm seeing this a few different times. Do you respond yes or no to looking for work?
Okay, that's a good question, right? So the question typically is, are you available for work? And the answer should be yes, you are available for work, but because of COVID-19, of course, work doesn't exist out there. So the way the federal government, and they've not let us change this question, we've asked, trust me, but we have to ask if you are still available for work. Because if you are not available for some reason, that will then put you into a non-monetary issue, a non-monetary claim that we have to go back in and look at. Unemployment insurance is designed as just that, insurance, right, for when you're out of work. And so they're trying to make sure that when you get back to work, or if you're available to go back to work, if you're not available to go back to work, that you're not getting that insurance then. So again, in this crisis moment, I know it's a little bit confusing, but keep saying you're available for work.
Good. Let's see. Another question I saw, when will self-employed PUA get funds? Status update wasn't mentioned in your update.
So, the folks who are PUA, Pandemic Unemployment Assistance, self-employed, 1099 workers, independent contractors, gig economy workers, those who made not enough to qualify for state benefits previously, who had fewer hours to qualify for state benefits, or who were on unemployment and their unemployment ran out previously, you are eligible to start applying as of last week. We got the federal rules. We were able to roll out applications. Again, the first in the Midwest, one of the first in the country, just one of like maybe 3 states that did that last week. We are processing now your payments and you are certifying starting this week. And so when you certify, we then issue your payments to you. So in the next few days, check back on your MyWham account, log back in at michigan.gov/UIA. There'll be a indication that you should certify, and we're processing those payments in batches. And so they'll come out, every few hours, maybe every 4 or 5 hours. We put a new set of individuals through that, and they can see that they can then certify, and then we release your payments. So those folks, there's about 300,000 right now who are likely eligible to certify this week. Most of those are pandemic unemployment assistance individuals. Again, you'll start getting your benefits this week, and every benefit is backdated to the first day of eligibility. So if pandemic unemployment assistance, if you were laid off for some reason, even as early as late January, you get benefits backdated to that date. So we'll give you a lump sum of that. You'll get every benefit you deserve. We promise that. Thank
you. I believe this might be along the same lines of underemployment, but someone viewing has 2 part-time jobs. How would unemployment apply to them?
So really, it's total income that we're calculating here. So if your part-time jobs, 2 part-time jobs, put an income again that makes you ineligible, then you wouldn't be eligible for benefits in this case. If you're working 2 part-time jobs and again your income is below $500, then you should apply and then go through the process.
Okay. Next question. If you owe money to an old UIA claim, are you still eligible for this? Let me put the question up on the screen.
Okay. So if you owe money to an old UIA claim, meaning that somehow we probably were asking you for money back because you were overpaid, I think what that would trigger as a non-monetary issue that we'd have to resolve. So it doesn't necessarily mean that you are not eligible during this period of time, but it probably means that we have to take one more step with you to be able to either settle that old debt before we can start paying you, or make sure that we go and call you. One thing just for everybody who's on this call, if you receive a call on your cell phone or on your home line from an 866 number or a number you don't recognize, please answer it during this period of time if you're waiting to hear from us. Because what we're finding is, even when our call center individuals are calling individuals who have these non-monetary issues, people are not picking up, and it's further delaying the time it's going to take to get you benefits.
So trust what might look like a spam number during this period.
Don't, I apologize if you have to talk to a spammer, but we're trying to get through to you. And so you can just feel free to hang up on them, but don't hang up on us because we're trying to help get you your benefits.
Got it. And a comment from Representative Kennedy. She asked if this was being recorded. The answer is yes, this is being recorded. You can share it from your Facebook. I know we're on Mid-Michigan Now, as well as YouTube Live. If you have individuals that you're aware of that are having any of these issues, please share this information. I have another question. It's a long one. I'm going to put it on the screen.
Okay.
If the unemployment application is being held up due to needing to verify reason for separation, Director, yep, good.
So that's one of the non-monetary issues, right? If your unemployment application is being held up because you separated from a company and we have not received wage records for your new company, which they trail by about a quarter or so, getting wage records to verify that you are employed. We will not know if you are eligible for benefits until we talk to you. And so that means that we just have to get some further information for you. It doesn't mean that you're disqualified. It just means that we have to, unfortunately, in this period of time, it's going to take us a little bit longer because the federal government requires us to personally verify your account status to be able to release those funds. So again, we appreciate the patience and we know it's frustrating.
Director, thank you. We're coming up on about an hour, so I'm going to hand it back over to Adrian.
Yeah, again, I wanted to take the time to thank everyone for being on the call. But before we closed off, I wanted to touch base with each of you for maybe last remarks before we leave. And Lieutenant Governor, we can start with you.
Sure. Thank you, Adrian, and to the whole team for convening, the senator, the director, and myself for this conversation. And thank you, everyone, for participating. I know this is tough, y'all. I know that both as individuals, we're facing things that we never imagined facing. We were asked to do things we never thought we would need to do. And we're also helping in ways that we never knew we would need to help or were even capable of doing. I'm continuing to be encouraged by it. Know that the professionals in state government are working as hard as we can to provide the services that we know everyone needs. Like, this is real. This is personal. I know people are struggling, people are anxious or afraid, and know that we are here to work through this with you, and we're going to do the best we can to make sure you have everything that you need, and that you're not going to lose out on something because we're going to make sure that you get it, even if it takes us a little bit more effort, a little bit more energy, a little bit more time. We're working on your behalf and alongside you. So I appreciate everyone's, frankly, just resilience and fortitude, stick-to-itiveness. And that's what's gotten Michigan to this point, and that's what's going to get us through and into our future that is going to be brighter than this. So I remain encouraged, and I hope that you will too. I know that this has hit people's personal lives in a hard way. It certainly has hit mine. I actually lost a cousin last night to COVID-19. And so I just also work to support one another and be mindful and empathetic toward one another as well. This is going to land on so many people in so many different ways, the mental, the emotional stressors are real, and just be mindful and empathetic and patient with one another, and check in on your people. That's how we're going to get through this as a community. So thanks for everything and all the work that everyone is doing, and please stay safe.
Thanks again, Lieutenant Governor, for joining us for this conversation. And again, my condolences on the loss of your family member. I'll go ahead and pass it along to State Senator Minority Leader Ananich.
Thank you very much, Adrian, and to you and to Tim and your whole team and board. Thank you for doing these. Ours, I think, was hopefully important information for folks, but also the other ones you've been doing to make sure that members and non-members, hopefully they'll join if they're non-members, have the updated information and make sure they know exactly what's going on and how they can protect themselves and their business. I think that's extremely important. And I want to reiterate what the Lieutenant Governor said. We're going to come out of this. There's a lot of hope. We've come through a real rough patch, but I think the adversity will make us stronger. It's difficult because we're social distancing, but that, as the Lieutenant Governor said, that does not mean we have to distance ourselves from people, right? We have so many technology and tools now, whether it's FaceTime or calling or, going to someone's window and waving, all the important things that I see happening, I think is a really good thing. There's a lot of stress. I mean, it's also stoking a lot of anger. If we can use that stress into a positive way while we get through this together, I think that's better. People can call my office. I know I can speak for Representative Cherry and Kennedy and Sneller and Rep Neely, and I don't know Rep Mueller as well, but I'm certain you can call him as well. Our delegation works very well together and will help with any concerns that you may have. The director is doing a great job over at Leo, and they're trying to address all these concerns. But if we can help, we're more than happy to do that as well. So again, thank you, Adrian, and my colleagues on here. We're working hard to try to get all these issues resolved as best we can. So thanks a lot.
Yeah, thank you again, Minority Leader Ananich. And Jeff, I'll wrap up with you for any final remarks that you might have.
Thank you, Adrian. And again, thank you to the Governor, to Senator Ananich and all the legislators on the call here. To the chamber, you guys do great work and appreciate all that, the work of getting this communication out there. I started my career actually working for the chamber. And I know how important the business community resources locally for those small businesses can be. So again, appreciate your work. I would just say this. I know that there's a lot of people on here who are looking for help with their unemployment insurance claims. We are committed to making sure that businesses and people get the resources that they need and that they are entitled to during this crisis. We know that for the vast majority of people, the system has worked, but we understand and the frustration of those who are having trouble. And we're very much working around the clock to make sure that every single person is helped during this crisis. If I could wave a magic wand and simply push out every benefit to people, I would. Trust me, I would push a button and do that. But we don't have the money from the federal government until we verify your benefits. So I just ask for that grace, that patience as we, again, move more people in the department, hire more people, have more people help unlock your accounts and begin processing those payments. And I just say to everyone, thank you for being a Michigander, for the work that you do, the resilience that you have, and we're all in it together. We're going to get through it together. Oh, Adrian, I think you're on mute.
Sorry. I just wanted to say again, thank you to all of our panelists from the Lieutenant Governor, State Senator Ananich, and Jeff for being with us today. Thank you again, the viewers, for tuning in. As everyone said, please don't hesitate to reach out to us as well at the chamber if we can be of any help with navigating the landscape. Thanks again and have a great day.